at RNAO and one of the BPSO OHT coaches with the BPSO program, the Best Practice Spotlight Organization program. Joined today with other members of our coaching team. So Dr. Doris Grinspan, who many of you probably know, she's our Chief Executive Officer with RNAO. Also, Olivia Clay, who is in the background there. She is our project manager, and she is your main point of contact with our program. And Kristen Campbell, who is a manager with the Implementation Science program and part of the coaching team. So that's the RNAO side. And then we are delighted to have 5 members of Cohort 1. So our very first cohort of Best Practice Spotlight Organizations, the BPSO OHTs. So we have Stephanie, if you can wave, Stephanie Coulson from Northwestern Toronto, Tanya Baker and Hélène Lacroix. I'm not sure if Hélène is on camera, from South Lake Community. Marjorie Conan from East Toronto Health Partners. Dania Versailles is going to come on at about 4 o'clock, so she'll join us very soon. So we're delighted to have these representatives who will, after we provide an overview of our program and some of the deliverables and what to expect in the program, they're going to talk about, what is it really like to be part of the BPSO OHT program and some of their highlights. So we're so happy to have that perspective. After that, Kristen is going to walk you through the next steps to become part of Cohort 2. Then we'll have time for questions and some final thoughts from Doris. So just welcome all of you and look forward to presenting this to you today. So for those of you who are not familiar, RNAO, or the Registered Nurses Association of Ontario, we are the professional association that represents registered nurses, nurse practitioners, and nursing students in Ontario. And we are a very strong voice of 46,000 members. We're a credible voice leading the nursing profession. And we have 2 main branches. So one, you might have seen and heard us in the news. We promote healthy public policy, we're very active there, and clinical excellence. So the Best Practice Guidelines program is a signature program of RNAO, and that's part of what we're talking about today. So our Best Practice Guidelines program, this is our model, and we have, you can see 3 main components of that model that are all integrated. So we have a guideline development, a team of guideline development methodologists who work with expert panels to develop guidelines, and we have over, I think, 54 best practice guidelines that are developed with a rigorous methodology, and we're meeting the highest international standards actually for guideline development. So we have really rigorous, strong guidelines that we want to make sure that they are actually implemented in practice. So that's the bottom left circle. So that's the dissemination, implementation, and sustainability program that is multi-tiered, multifaceted, and has support at the individual, organization, and system level. And the BPSO program is at kind of hovers between, it's definitely organizational level. It's also, the OHT is more of a system level approach. And then we have the guidelines. We need to make sure that we're monitoring and evaluating the implementation of the guidelines and the impact of the guidelines, because we want to impact the people, the patients, the clients, the providers, the organization, and the system. So we have qualitative and quantitative approaches for evaluating and monitoring guidelines. NQuire being one of the main pillars of the program, which is a data repository of quality indicators for monitoring and evaluating. So the Best Practice Spotlight organization that you're here to learn about today, we have 2 types, service BPSOs and academic BPSOs, and then 4 models. And this started in 2003, and I think we started with 7 or 8 BPSOs in 2003, and now 2021 we are over 1,000 Best Practice Spotlight organizations around the globe, actually. So what on the very bottom is the BPSO OHT. So here are our acronyms. This is what you would be participating, partnering with us in and your team in the OHT to collectively implement best practice guidelines as a coordinated team. So I just wanted to show you a map here of, this is just the Ontario BPSOs. So we have all types of academic and service BPSOs in Ontario, now over 500 of them in total. So when you're part of the BPSO network, that means that you are sharing resources, you're sharing knowledge, you're sharing ideas, inspiration, energy with others in the entire network, the access to tools and resources in Ontario and actually on a global scale. So let's talk about the best practice spotlight organization Ontario Health Team model in particular. So this is designed for integrated systems of care. And the goal is to optimize patient or person outcomes. And we're doing that through evidence-based practice, our best practice guidelines, and robust staff engagement, really engaging the staff actively, so they're actively participating. And I just want to show you here, explain that the BPSO OHT, you can see it's kind of nested within the OHT program. So what we've heard from the participants in the program, that the BPSO work helps to accelerate the OHT work, that it helps to foster that collaboration that you really need to make the OHTs function well, and it gives it a little bit of structure. So it's a component of, or it's nested in the OHT. And then you see below are our two focuses towards our goal of evidence-based practice and robust staff engagement. So I think what I'll talk about now is the Quadruple Aim briefly. So the BPSO OHT program is aligned with the Quadruple Aim, which is a major goal of the OHT program and through the government. So starting on the top left is improved provider experience. So we have kind of two approaches that we use with this program. We have a structured methodology with a knowledge to action framework, which is this sort of a 7-phased approach. It's more of a step-by-step approach or structured approach to implement and sustain guidelines. And then we have social movement approaches that are mobilize and engage people, so for a bigger impact and some collective action and collective identity, so that energy that improves the experience for the frontline providers in their care. And patient outcomes, so we have lots of evidence through our evidence boosters and our evaluation systems is seeing improved patient satisfaction, improved care coordination, reduction of falls if that was a guideline that you chose, or reduction of pressure injuries if that was a guideline. Patient experience improved through, so we have two mandatory best practice guidelines. One is person and family centered care. I'll show you in just a moment what those look like, person and family centered care and care transition. So those were chosen because they align really closely with the OHT goals, and we consider them to be foundational guidelines for a team across the sectors. So those guidelines are directly influencing the person's experience of care. And then on the bottom left, the lower cost of care, we found with the systematic implementation of best practice guidelines that does reduce, that results in reduced, results in cost savings. Sorry about that. So let me walk you through some deliverables, because when with the program, you sign a contract that includes these deliverables. So I think you would probably be interested in knowing what they are. So the Best Practice Spotlight organization, you partner with us to implement multiple guidelines. And at the end of 4 years, so it's a 4-year pre-designate partnership. And at the end of the 4 years, you achieve designation. And you can see that there are 5 pillars of that I'll walk you through: infrastructure, capacity building and knowledge exchange, systematic guideline implementation, dissemination and evaluation. And then once the 4 years is complete and you've been successful, and we coach you and support you towards being successful at meeting those requirements, not just us actually, not just RNAO coaching, but you're coaching one another, and then you're coaching within the network as well and supporting one another. So then you achieve a designation status. And after that, you're sustaining the use of guidelines, expanding guidelines, adding more guidelines, spreading and mentoring others. There's a culture of mentoring one another, a culture of sharing within the BPSO community. So digging into some of the deliverables, the infrastructure is really critical for the sustainability of the program. So we want you to take the time within your organization and across your OHT to carefully think about the infrastructure to make sure that there's some coordination, good communication strategies and ways to report in on how you're doing and some accountability. So I'll show you on the next slide one of the samples of infrastructure that we give you. You need to have a steering committee and a lead who's a key contact for RNAO. And then each organization within your OHT would have a lead. Sometimes there are co-leads from your organization. And then within your organization, because you're implementing 4 guidelines, you would have a lead for that best practice guideline, or sometimes a co-lead. And in fact, with person and family-centered care, some organizations are having a healthcare professional teamed with a patient or family member as co-leads for the person and family-centered care guideline. Having teams to support the implementation and evaluation, and then some processes in place to enable some communication between your BPSO OHT and the steering committee and RNAO. We like to be involved on occasion to attend an OHT steering committee to have a bit of presence there. So here's a sample of the infrastructure. We just reviewed different infrastructures from the OHTs and have seen variations on this, but what's really important is that you think about how this connects with and advances other initiatives. And we've certainly heard over and over again that the BPSO program helps organizations to achieve their accreditation status. It helps align with the existing initiatives or goals that are already within the organization. So, or the OHT, so maybe quality committee work, professional practice work. So it's meant to not be an add-on, it's meant to help accelerate, it's meant to help augment, help to strengthen, mobilize work that you're already doing. So you can see these afterwards, but it shows the OHT steering committee, the BPSO steering committee, then your leads in each organization, and then that fans out into a structure. So they can certainly look different from this, but this is a start. Capacity building is really critical, and this is kind of where we start with the BPSOs. So we have, with 3 of our 4 BPSOs, we actually met in person together, and we had professionals, health providers, family and patient and family members learn what it's like to be a champion, come to the champion training in person, and one of them was virtual, and attend that champion training together and participate in learning like they've never really met before, across different sectors, different disciplines, and learn together. So that's kind of one of the initial kickoff events that we do, is some training, and then we continue to build a strong network of multidisciplinary champions. So by the end of your 4 years, we're aiming for 15% of your staff, like a critical mass of individuals who really care about advancing excellence and evidence-based practice. So we do ongoing training with RNAO and internal with your lead champions. And we have training for the Enquire system, and then various knowledge exchange events like a knowledge exchange symposium. We had a meet and greet event in September, which we had excellent feedback on. The OHTs were learning from one another. So the systematic guideline implementation, there are 4 best practice guidelines in 4 years. So the top 2 there are the mandatory person and family centered care and care transitions. And then your OHT decides together what those other 2 guidelines will be, those guidelines that align with your priorities and your populations that you serve. And then you're developing action plans and plans to monitor the BPG implementation. We have knowledge exchange meetings approximately once a month, especially in the first year. And then there's exchange of tools and resources and innovations across the broader network and in Ontario. We have BPG or best practice guideline order sets that are available. That's optional. And then if any of you on the call are actually already a best practice spotlight organization and you're part of an OHT, you would be called on, like Tanya from Bayshore, who's with us today. Bayshore is already a longstanding BPSO. So she's been providing kind of on the ground mentorship with the collective, which has been really helpful. And that's the case with others as well. This is a picture of the 2 guidelines. Care transitions is just under revision. So that'll be ready for you for your 2nd year. And I mentioned before that our implementation approach, we use 2 frameworks to scale and spread. So there will be more details and resources and information available actually right in time for you when you're starting with our new Leading Change Toolkit that uses these 2 frameworks, the Social Movement Action Framework and the Knowledge to Action Framework. Dissemination. So you will be using the best practice spotlight organization logo. We want you to use it broadly because it helps to establish that presence in your organization and the OHT. It helps to support collective identity. And on your website to have some presence of the initiative. Also on social media, if that aligns with the policy in your organization. To share outcomes within and between your organizations, as well as the broader community. So this is an example today, is that we have members from Cohort 1 who are sharing some of their outcomes and their experiences for Cohort 2. So they're already acting sort of as mentors for the next cohort. And then by the end of the 4th year, 1 collective manuscript that you would write together. Evaluations, so I mentioned the NQUAR system, so participating in the International Data System. NQUAR stands for Nursing Quality Indicators for Reporting and Evaluation. So you're collecting data for guideline-based quality indicators. So it's about monitoring and evaluating your progress. Twice a year, we've just finished this process recently and been talking about it this week, is the My BPSO Progress Report. So those are fairly simple online reports that help you kind of keep in track. And actually someone today said, you know, I really enjoyed doing it because it reminded me how much great work we had done. We have the advanced, this is brand new, and we're very excited about this. This is the Advanced Clinical Practice Fellowship that's been designed for Ontario health teams. And this is individuals or teams within your OHT that are observing and looking at the experience of a person as they move from one sector to another within your OHT and providing quality feedback on the experience of person and family centered care. So we're really excited about that, and that will be starting soon. And we also call on you to help support the evaluation of this program. So we developed this program in response to and to support the health system transformation happening in this province. And it is a new program. So we've relied on our first cohort to help us shape it. And they've done, it's been very, very helpful. And we're thankful to them for helping us shape it and continually improve it. And you will do the same with us for Cohort 2. And then also regular quality improvement activities to monitor the evaluation of the guidelines. This is some data from an Enquire report, and it's showing, so you are able to create reports like this through the Enquire data system, and you can use this for monitoring and reporting back to your stakeholders and your staff, and to see how you're progressing. And then if you're interested, you can also, we have templates for evidence boosters, and you can create your own evidence booster that shows, what was the guideline you developed? What were some of the strategies you used? And what is the data story there? And it can be very impactful and a useful tool to disseminate to your board of directors or your patients, your staff, and others. I'm just getting towards the end of my section here, and wanted to provide you with an overview of some of the supports that RNAO offers. So we have resources, a secretariat that support the development of this cohort and the development of cohort 1 and 2. We have a coaching team. So I introduced you to members of our coaching team who are on the call today, and we also have members of our evaluation team who provide one-to-one consultations to you to make sure that you have the support and infrastructure for evaluation. So it's about consultations and guidance and support, and help you with all those processes that you need along the way. So getting the word out there with the dissemination, what you're doing, the implementation, uptake, evaluation, and sustainability. So supporting with action plans, the capacity building, the training. We have a building, we already have and are building a large repository of resources to share with you, so that it makes it easy for you, and you don't have to kind of recreate something from scratch. We meet with you virtually for right now, and maybe in the future more in person. And knowledge exchange events, and then we provide reports to the OHTs that you can use. Like RNAO provides these reports to you that you can use with your board of directors or your CEOs. You can share them with your OHT steering committees. So we've just received the My BPSO reports. We'll synthesize that and send a report that you can share. So you can leverage this for your OHT designation for the Government of Ontario. So be thinking about that as another tool for your success with the OHT. So I've been talking for a little bit. And I might have gone a few minutes over time. So let me go straight to hearing from our guest speakers today to talk about the lived experience, and starting with you, Stephanie.
I'm Susan. I just joined. Sorry about that, but I was in a meeting with the ministry, so apologies.
Okay, all right, great, Doris. Well, we're just past.
I heard.
Okay,
it's,
great.
They're fab.
Okay.
Hi, Doris.
Hello.
Hello, everybody, and welcome to this exciting opportunity. My name is Stephanie, and I am the Quality and Risk Mitigation Manager at an organization called LumaCare in our Northwestern Toronto OHT. And today I just have a couple of minutes to share with you just the tip of the iceberg of how we've been able to leverage our year 1 person and family centered care guideline with our COVID-19 response this year. When we had looped together and had our initial training kickoff back in, what was it, December of 2019, we had no idea what we would be collaborating just on, and so what a difference this has made for us. And so I had just a couple slides to share with you all the different ways to kind of summarize just what Susan had said earlier. A couple things I stole from you when you said fostering collaboration and supporting and building structure. And I think while the OHT was very much developing in this last year in the midst of a pandemic, having had the BPSO program to be able to foster that collaboration really strengthened our ability as an OHT to come together and respond, and also build connections that we might not have otherwise had before. And so it really fostered a lot of that collaboration. And through the what we call our knowledge exchange calls, as Susan described, monthly, even with all of that was going on in this past year, we maintained those meetings for the most part with good, strong attendance, and really use sometimes that as a platform to not only talk about the BPSO project, but to check in with each other as an OHT. So it was a really strong support network, and it was very, very helpful throughout that time. Linking specifically to LumaCare, my organization, as well as our OHT, virtual care was one of the ways that we were able to pivot our response to support our clients in a variety of ways, and listening to that client and family voice in responding to their needs and actioning that out in the community. And so when I just highlight a couple of things here, you know, for clients on one end, we talk about checking in on their well-being and constantly having that touch point to reevaluate and seek constant continuous feedback, one of the BPGs, to be able to augment our services in response to them. And then also for our staff. So it's when you think about person and family-centered care as a guideline, we talk about the person that people that we're servicing and their client and their family, but also the guideline ties in staff as well. So on here, we talk about virtual town hall meetings that we were able to house. And so I share that this was something that we shared as us as LumaCare of what we do, but we would share that within the BPSO OHT knowledge exchange and go, oh, I didn't know that you did that. How about, or sharing resources, links, trainings, and etc. So that's virtual care. Next slide, please. And then another big one was mental health. So I really wanted to share that, again, a focus on pivoting a lot of response to the staff and our frontline workers and how they're able to cope and adjust during this time. A lot of resource sharing had occurred within our OHT, and the guidelines certainly helped to provide a framework for some of our responses. So again, weekly touch points, town hall meetings, staff training with mental health resources, and then again, that collaboration with our OHT around what we had in our own backyard to support staff. Next slide, please. Yeah. And then same thing. So really just talking about food security. Food security, a big hot topic, really big way that we've been able to pull together as a community to help each other and help our community at large. And so again, collaborating with our OHT through the BPSO program and really going through specific BPG recommendations to help guide and inform how our responses were to help support our clients. And that's pretty much it for me. So a very high level snapshot. It's so much more than that, really, but we're very thankful for the opportunity.
Thank you so much, Stephanie. So let's turn it over to Tanya and Ellen from South Lake Community.
Best take myself off mute. Hi, everyone. I'm Tanya Baker. I'm the Director of Clinical Practice, Education, and Infection Prevention and Control at Bayshore. And my colleague here is Helene Lacroix from SE Health and is the VP of Clinical Innovation. So we are part of the South Lake Community BPSO OHT. Helene and I co-chair or co-lead this group. This is just a snapshot of all the different participants in the OHT. And just one of our Zoom calls that we have on a regular basis to meet and share experiences and ideas and just collaborate on how we can move person and family-centered care, the BPG forward. So this is an action slide that we had from our meet and greet. And just if you want to go through that quickly, Olivia, it's just, we met with our champions actually within each of our organizations to really identify what strengths we felt or our champions felt that each organization brought to the table. And it was so interesting to bring those together as a group. And if you just keep actioning this slide, yep. So each organization was able to identify the strengths that they bring to the larger OHT and to the BPSO OHT, and how we together bring together this collective strength and knowledge, and just it's really empowering to meet with the group and just to share all the innovative ideas that we have had. So Helen, I'll pass it over to you. And
great. Can you hear me?
yes.
Okay, perfect. So although I think many of our experiences also echoed the first presentation that you heard, with lots of collaboration, and the connections together were just really incredible. And it's interesting because I think our experience, I'll say there's a lot of type A personalities on our team. And I think our individual team members, especially our leads, might at times feel like we are moving forward slowly, especially within sort of the environment that we're all living in and all of the sort of collective strains that we feel. We have been able to pull together a collective single work plan for our BPSO OHT, and with real clear outcomes and dates and responsibilities. We are sharing shamelessly the resources that we own collectively, including amongst sort of sectors that potentially would not have done so in the past. We've pulled our collective champions together to assist with planning, and what you see in front of you is that one of the tools that has actually been created by our collective champions, highlighting what they perceive within our OHT in our area is really meaningful, from the person and family centered care guideline, which we are beginning to implement or further implement now, and and then honestly, just sort of trying to keep to the timelines, what really energizes our team is exactly what the foundation of the BPSO OHT is all about. And Susan talked about it earlier, and that's really the power of our collective. And I truly believe that we are living this. And you know, it is what keeps us coming back to the table every 2 weeks to talk about how we're now going to push forward one more time, try to get something else done again amidst, and I say that so respectfully, amidst the, you know, the workload that just is expanding as we're sort of hitting such a critical area or critical time within the context of wave 2 of the pandemic. So I'll just stop there. Thank you very much for
if I may comment, Helene, because I think you hit on something so important. For those that are not involved in this movement of BPSO, we have heard over and over, also in the knowledge exchange in the middle of the pandemic, how this program energizes the staff and brings a source of positive connection, really, on something that is positive, that is still keeping focus on the patient, despite of all the gazillion politics, not only workload, but the reason I was late was politics, simple politics. And it really keeps us anchored into what's important here. That person in the bed, or that person in the street, or that person in the home, etc. I just want to point out what I was fighting before, and you will see it in the media today. A patient was left 14 days in their home without nursing care and PSW care. Horrible. Patient with COVID. But let me tell you something. I'm not excusing it. Home care nurses, or PSWs, are not even in the picture of being vaccinated. And yet administrators in a hospital that are not with patients are. There is something deeply wrong in how we approach who is at the center of the patient and his patients, regardless of which sector they are. And his staff that are frontlining now, regardless of which sector they are. So I think I link this to the BPSO program because that's where we are focused. We are focused on that patient, the intersection between that patient and the healthcare provider across all sectors equally. And that's why so much I enjoyed the presentation of Loft also, because people in the community are suffering big time because they're not being a priority, because they're not the priority of the moment. But the person with addictions, like some of our KMH and Central Mental Health and Addictions that I think Daria is today here, those are people that are suffering as much as people with COVID. And I think we are forgetting some of that in this whole crisis that we have that is pulling people apart from one another politically. Let's stay focused, right? And this is what this program is trying to do, as well as trying to bring all along. Imagine if this is in difficult times, what this program will do for you guys in good times, right? In terms of its positive energy based on evidence-based practice and focusing on positive activity. And I'm glad that now Marjorie is coming next, I believe, because I keep pointing this, and Marjorie, feel free to share in your organization. I kept pointing it to the media today when they were talking with me about another OHT that is not one of ours, but things are going not as they should in terms of vaccine rollout. I kept pointing out at the BPSO OHT of East Toronto Health Partners. Because from day one, whether it's Jeff going in his car to see what was happening with homeless people in the streets, or whether it was him and the team at Michael Garron moving PPE to the shelters, quite frankly, and to the nursing homes, or where was the vaccine that now they finish not only their frontline providers in their hospital, but across that, you know, in nursing homes. They finished that, they completed that. And now they're going to move, I understand, and Marjorie, you can tell us more, to shelters and others. Like, let's keep focused on, during this crisis, on those people that are more at risk, both within our organizations, which is front care providers, and within the system as a whole, which is vulnerable populations. It will teach us a lot. It will teach us a lot also on how this program is important in keeping us anchored. So thank you, Helene, and I just needed
Thanks,
to
Doris. Thanks for the kind words. So I'll go next. Nice to see everyone. Marjorie from East Toronto Health Partners, and I'm part of our backbone team supporting the Ontario Health Teamwork. In our first slide, you'll see an overview of how we've gotten started with the BPSO OHT, but I want to take you to what to me was the beginning, and it was when two nursing leads from two of our anchor partners in the OHT came to speak to the East Toronto Health Partners operational team to talk about this. And one of those nursing leads was Catherine Nickel from BHA Home Healthcare, and she was speaking about BHA's experience as a BPSO organization over many years. And the other was Irene Andrus, who saw the opportunity to get involved with the BPSO work within Michael Garron Hospital to advance evidence-based practice and the quality improvement work within the hospital. And they were quite persuasive, as were Doris and Susan in later meetings. And that led us to sign on as an OHT in October of 2019 to start this journey. And it's really developed into quite a strong and robust partnership across our OHT. Different organizations have different ways of participating. So BHA and Unity Health Toronto both had a lot of experience with RNAO and as a BPSO previously, and they have been invaluable, strong mentors to us. Michael Garron Hospital and our lead community health center, South Riverdale, are fully signed on and committed and taking leadership as well. And then we have a number of other partners in the OHT who may not have signed on officially to the BPSO OHT agreement, but have shown up to our steering committee, have sent people to the champions training, have stayed involved and interested, and have led different aspects of work. And so it's been a real valuable network for us. When we had the champions training, we had 15 anchor and engaged partner organizations represented, including long-term care, including caregivers and patient representatives. And that was fantastic. In the next slide, I'll show you more about our development of a collaborative quality improvement indicator. We started this just a couple months after we signed on to the BPSO OHT partnership, where we looked at a long list of possible indicators for a collaborative quality improvement plan. and went through a whole process of, with all the different organizations and sectors and patients and caregivers around the table, what would make sense for us to tackle collectively. And it just came through that the person family-centered care outcome indicator made so much sense for us to take on, not just because it was relevant across organizations and across sectors, but we just saw such a benefit in aligning our work and our quality improvement around a best practice guideline that we were committed to already, and applying the knowledge to action framework and the social movement approach and using the RNAO coaching to help us along the journey. So we're at that point you see with the arrow. We have an aligned measure in quality improvement plans this fiscal year that we're collecting data on independently as separate organizations. And it's moving us along this maturity journey where we've really started thinking about this potential to collect data across the integrated system of care and to do our quality improvement across the system rather than within individual organizations. And so that's been a huge tool in moving us along. The next slide, you'll see just one of the screenshots from one of the key outputs of our work so far, which is an e-learning module for person family-centered care. And it was a great collaborative effort to work on this together. It's just, we have a pretty basic introductory module that's relevant for staff of different types across our organizations. It benefited for sure that we already had a shared learning management system that allows for easy dissemination across many of our partners. But we've also used our website, ethp.ca, to post links so that anybody can actually take the module through a direct link or download the module for their use within their organization. And I'm just going to finish with, when I was preparing for this, I put the word out to colleagues to say, what do you think are the key messages we should share? And what I heard back is that this BPSO OHT structure has really fostered shared commitment and a willingness to collaborate across organizations in projects that are meaningful to all of us. And as we've engaged stakeholders across our different partner agencies, we've discovered a lot of similarities across our varied organizations. And the person family-centered care has been a great place to start as a core concept that's transferable no matter what piece of the healthcare system we're touching. And we're just starting in our journey and looking forward to really strengthening the frontline engagement and advancing our integrated quality agenda. Thanks.
Thank you so much, Marjorie. So lastly, I'll turn it over to Danya. And if you're starting to have any questions, you can start to put them in the chat box. So welcome, Danya.
Thank you. Happy to be here. Hi, everybody. You can move on to the next slide. Excellent. So this is our BPSO OHT, composed of just 5 partners, but mighty. We cover an area that would be equivalent to Calgary, Edmonton, Toronto, Montreal, and Vancouver if they were placed one next to each other. So a very large area. And what's unique also with this BPSO OHT team is that we are, one of our high priorities to address the needs of the Francophone, population, person and families. And so we're part of a bigger, team, but you will see in the next slide, but don't change the slide yet, that we cover a large area, but with very few partners. So you see public health, Montfort Hospital, community mental health with my association, the Canadian Mental Health Association in Ottawa, and Montfort Renaissance, and the center, I can't see here, the CHC, the Community Health Center from de l'Estrie, which is further east of Ottawa. So it's only last August that we completed our workshops virtually. I believe we were the first virtual group to complete that. It was an amazing experience. Everybody was thrown into the Twitter world, and we're busy trying to compete to get the prizes. But all this to say that, if you go to the next slide, we developed pretty quickly a tight-knit, I think, relationship and partnership, where as we were energized by what's before us and what the possibilities that's belonging to a BPSO team meant to us. And so I think it was the second or third afternoon, we were asked to right away to try to draw a picture of our collective identity. We did our best, but keep in mind, this is the first draw of many, I'm sure. And I can't point, but on the left-hand corner up above near the sunset, or the sunrise rather, there's a fleur-de-lis here to represent our Francophone culture, and recognizing that the Francophone culture comes from many different area of the world. So for us, it was important to put on the map. At the bottom left-hand corner, you'll see a hive of bees representing the many different communities that Francophone service providers that exist on the territory that I described before, mainly because we're in minority on that landscape, and so there we are facing extra challenges. And then if you go across the screen on your right-hand side up above, you'll see different clients and the stating that says nothing about us without us. So again, we wanted to underline the importance and contribution that persons and people and their families can bring to our table, to our meeting, as we, work to improve the system, especially to integrate PFCC in the work that we do. And at the bottom here represents a statement that actually one of these person with lived experience mentioned. Actually, it was a family member. She said that communication was like a very high valuable asset to embed in everything that we do as we integrate these best practice guidelines. I have to say, I just came back from chairing the mental health and addictions subgroup of our OHT, and we were just looking at the milestones that were listed in our payment agreement from the ministry on what we have to report on for the next 15 months or so. And the PFCC BPG is really addressing, just like Marjorie mentioned, every aspect of the improvement that we need to put in place at the OHT level. And earlier I was meeting with our QI, quality improvement specialist, with a quality improvement plan coach, and to help us determine our plan for the next year or two, in addition to having accreditation scheduled at the end of the year. And again, the person and family-centered care practices came as an absolute must to integrate into the planning, into the work that we need to, to do. So from any angle, this is a great starting point to address, to face the challenges that are before us. So I'm not sure if there's the next slide on.
Yeah, and then we'll leave a little bit of time for some questions and the next steps as well. Thanks.
So the lessons learned really is that partnering with clients by being attentive to their needs and capacities effectively engages them in obtaining the right care and services. We need to be open to new possibilities and think outside the box and creatively to really align our collective strengths and to complement each other in the areas that we need, that there are more deficits in. And yeah, and not to forget that a client's family is what they say it is. We need to see and do the work that we do from their perspectives, because that's what matters. Thank you.
Great, thank you so much.
Susan, I would like to address some of the questions already there because they're important.
Sure. So we'll just leave this. Yeah, go ahead, Doris.
So I see a question from Brenda. Brenda, in which OHT are you? If you can write on the chat, in which OHT are you? I don't see.
I think Brenda was from Grand River Hospital in Kitchener, also part of KW4 OHT.
Okay, so Brenda, you can tell to your people what we now need. Number one is letter of intent. Then we will plan how many we take now and how many we take after. So I cannot answer to you, and I'm the one that will end up making that decision in dialogue with the ministry also, when we will take a third cohort. So if your organization is interested, simply fill the interest letter that will go out today or tomorrow. I don't know, my team will tell you. And then we will be able to get back to you and say, if you cannot do that now, can you start in 2 months, 3 months, 4 months, post-COVID? Because that's the piece that we will plan together. We will never impose that into organizations. So that's the question for that. And it's because we already have organizations that in advance send to us that they want to move. So it all depends what's the situation. But my suggestion for you is reserve your spot and put a letter of intent. Talk with your organization and give us an idea of when you feel you will be ready to get moving with the process. We understand that no one will get moved. Well, I shouldn't say that because I will tell you why I shouldn't. I was going to say we understand that no one will want to get in the middle of the pandemic, January and February get going. But being that said, actually, I am doing a whole training for the government of Chile. They are bringing 12. They already have 6 hospitals for a couple of years. They're bringing 12 new public hospitals across the country in March, in the middle of this pandemic. They're a bit behind us because it's helping them actually do what our colleagues are saying, stay focused on patient-centered care, is helping them with transitions on care and a bunch of other things that is needed in that country. So put your letter and basically say, we feel we are ready that we could get going with this in, I don't know, March, April, May, whatever that your CEO and others will tell you. So that's with that. Workload. We heard about bi-weekly meetings, etc. I think this always reminds me about the questions about workload in nursing. I think number one, workload needs to be balanced with what do you get out of that workload? If what you get out of this workload is that through the engagement, you get more energized staff, it's not workload, it turns out into hours of work versus workload that result in more energy, right? And people are more motivated. If it helps you advance the areas that anyways the OHT needs to advance, as a couple of, well, I think all of our colleagues that I heard are saying that, Margie and Daria in particular, but also Bayshore, then it means it's helping you advance. So it's not workload, it actually saves you at the end time, right? So I would let the colleagues in the ground to answer to that. I just wanted to make that comment. If an OHT is selected as part of the second cohort, when would that work begin? So first of all, what we will do is the letter is going now. The application is, I believe, what did we say?
Right on the screen, Doris. These are the next steps. And I think Chris.
So we will tell you, but if we will need to adjust because your specific OHT wants to start a month or 2 later, that is not where our focus is, not a big deal, okay? So again, if you are interested, apply, and then we will coordinate when. We would like, of course, to start all the second cohort together as we did here, but actually we didn't. We started 3 of them together. Ottawa joined a bit later because they were not even an OHT, Ottawa Francophone. And now they're catching up anyways. So, you know, we will work with you the when, just commit to it so that we basically reserve a spot. Because already we have one And I don't think they're even in the call because we already had met with them in the north that they are joining. So we will decide together with you. It will not, the timeline will not be imposed on you. And then I don't know if this another question would, okay, our colleagues are answering.
Yes.
Are there any other questions?
Lynn and Marjorie are also answering some of these questions.
Lovely. And you can put your emails, guys. Maybe they want to connect with you directly. We are totally okay with that too. So if there are other questions, if not, then we move to the next steps.
And maybe, Kristen, you can go over these dates and then people can put in any additional questions, and then we'll go back to Doris for final, answering the questions and closure.
And
Sure.
people are asking if we can send them the slides, and I would suggest that we will post them. Not only, we should actually post this whole presentation if it's okay with the presenters and the slides attached, because it will help others. Because I know for a fact that 2 other OHTs wanted to join, but the CEOs had not learned about that till yesterday. So here you go. Not always the information trickles down. So we will be sending them that as well.
Okay, great. So thank you. My name is Kristen Campbell. As Susan mentioned, I'm one of the BPSO coaches. So we just wanted to review these important dates and timelines with you. But as Doris mentioned, we are willing to work with organizations as needed. So there's the letter of intent that we would like to see back by January 25th. I think Olivia has posted the link to that. It is available online for completion. We've tried to not make this too much work for you and try to simplify the process as much as possible. Successful BPSO OHTs will be notified by February 12th of this year. The contract due dates, we're looking to have those back by March 31st. The launch of BPSO OHT Cohort 2, I think someone asked that question in the chat. We would be looking at May 2021, and we're working out those details. In the BPSO OHT Symposium, we wanted to highlight this because this is an excellent opportunity for knowledge exchange and for bringing, it's a forum to bring the BPSO OHTs together from Cohort 1 and Cohort 2 for sharing of dissemination strategies, implementation strategies, evaluation, sustainability. So it's really an opportunity to learn from each other, just like you have here today, hearing from our guest speakers today from the various OHTs. So just wanted to quickly leave time for Doris, as Susan mentioned.
I don't know if anybody has questions before I do closing remarks. Otherwise, I will first thank, I want to thank first the presenters, not only because of what they presented, and Susan included and you included, Kristen, but actually for the passion and the commitment. And I just because of my experience with this program for so many years, the passion comes from the program, really. The passion comes from what we see. To me, happens the same, from what we see in the field. So for those of you that presented, that are representing OHTs, please know that my passion, or Susan passions, or Kristen, or Olivia, all the colleagues that you see interact with you, comes actually from you, from what we see, from the impact that we see that this is happening. And then when you layer that, because even the BPSO OHTs that are already with us have not realized it fully, that you are part of a network of over 1,000 BPSOs around the world, and that governments like Spain are thriving on it, that governments in Chile are expanding on it, that Australia is expanding, et cetera, et cetera. It's really the same that you guys said, that you're developing a, cohesive togetherness. We call it collective identity. When you start to see that others around the world share that with you, and that others around the world that, quite frankly, in some countries like Spain, are way more advanced than us in terms of OHT, because they have had integrated care system for many years. That opens a lot of other windows of opportunity for you to connect with them and learn about aspects that are not related necessarily to the BPGs and BPSO, right? So it really will be something that I know you will leverage and gain from it for years to come, and they will gain from you too. So thank you to all the presenters and to everybody that joined today. Thank you very much. And let's keep safe, please. They're saying 2 masks now. Here you go. At least in many countries they are. I would listen to it. Take care. I'm talking outside if you go to a store or whatever, which we shouldn't do much of that anyways. Thank you so much.
Thank you everyone so much. Stephanie, Marjorie, Dania, Len, Tanya, our team, all of you who joined us today. There's Olivia's contact email. So please take a moment to jot that down. We'll also be following up with you afterwards for everyone who signed up and attended, and make sure that you have all the materials you need. So we really do hope that you'll join the program with Cohort 2. We're excited about that and building this for, making these amazing outcomes happen in our province. So best wishes and take care, everyone.
And by the way, what we can say also, Susan and Olivia, is if you have staff, any staff that speaks Spanish, for real, and they want to join the training that we are doing with the government of Chile and about 12 or 14 of their hospitals, any portion of it, absolutely you can as an observer, if they want to see what it looks like.
Great.
Here you go. That's in Spanish though. That's why I said Spanish speaking.
Hope you want to practice your Spanish.
Here you go. Take care. All the best.
Bye, everyone.
Everyone. Bye-bye.
Bye.